there are many respiratory therapists that literally take their act to the roads. As home care respiratory therapists, our MSRC camera spent the day with David Noffke in his role as home care respiratory therapist.
Hi, my name's David Noffke. I've been an RT for about 23 years. I work for Metron Health Care. I've spent 10 years working in a hospital. The rest, another 10 years working for a pulmonologist doing diagnostic testing. And on and off for the last 15 years I've been doing home care. I'd just like to say that there's a great difference between the hospital environment and the home care. In the hospital environment, obviously you have a very clean place to work, it's air conditioned, you're dealing with people that are in bed. In the hospital, obviously the patient is in bed and they really don't participate in their care. So it makes it much easier from that standpoint. And the equipment is usually top-notch depending on what facility you work at, but if something breaks, you just go back to the department and you get a new piece of equipment. Home care, on the other hand, is a totally different ball game. For any of you who have done home care, you can probably expect the unexpected. You're not sure when you call somebody what kind of environment you're going to be in. They range from clean to not so clean to beyond. At home, the patient education is pretty important because once you leave the home, the patient is responsible for the treatment. So you want to make sure that they understand completely what they're supposed to be doing with what piece of equipment. And monitoring the patient is important as well because some patients are compliant, others are not so compliant. You go from one extreme to the other where certain patients think more is better, so if they're on 2 liters they're going to crank it up to 4. And other patients, they don't use their oxygen for 3 or 4 days. Equipment's a big issue in home care. Obviously there are people who really take really good care of their equipment. Other people kind of just are oblivious to any kind of maintenance whatsoever. People have lost equipment. Some people abuse it. So you really have to keep on top of things as far as people being compliant and really maintaining their equipment. A typical day for home care obviously starts with getting into the office and checking any new orders they might have. It involves patients to be called. I check with physicians to keep orders current. I do follow-ups. The day is really, you really have no idea what is going to happen during the particular day or when it's going to end. Most of all, it seems like a continuous series of driving and phone calls. I really enjoy setting CPAPs up. It's very difficult for a lot of people to tolerate the CPAP, so that's where the coaching comes in and proper mask fitting technique. You know, if a patient doesn't have a mask that fits comfortably and doesn't leak, then it's just not going to work. So I'm not only a technician in that sense, but I'm also a coach. So it's been quite rewarding for me. Sometimes it takes going to the physician's office to get paperwork signed, which is part of my job, and I'm more than happy to do it. Yeah, a lot of strange things have happened to me. You know, dogs. You know, I've become speedier in my old age. You know, houses that there's nobody home or they don't have an address on there, so you're not sure. No phone. You're not sure whether you're actually at the right home or not. And since I'm colorblind, I don't like directions by somebody giving me the color of the house, especially in the evening, because I'll drive right by it. Somebody will say, well, the White House with the light on. As far as on-call goes, most RTs dread being on call for more than one reason. going out at nighttime, driving way after midnight, getting lost in a storm, or a number of other issues. But it's really about the questions that you ask on the phone with the patient when you initially contact them. Success in home care is probably most dependent on teamwork. We have CSRs, drivers, RTs, sales. Without everybody's cooperation and working together, it really is difficult to succeed. I've been working at home care a fair amount of time now, and I'm really happy doing it. I like the autonomy that I have. I enjoy talking to people. When you do something long enough, you get pretty good at it, and I'm very comfortable with my skill level. I also touch on the fact that I did work in a hospital in an ICU for 10 years, and I worked hand in hand with a physician doing diagnostic testing. So drawing everything that I've learned over the last 20-some years, I feel I'm in a pretty good place.